to Health IT in Government. Here's your host, Jim Flyzik.
Good afternoon and welcome to the show. I'm Jim Flyzik. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me today on the show are Dr. Alan Constantian, the Deputy CIO, Account Manager for Health, Office of Information and Technology, Department of Veterans Affairs, Dr. John White, the Deputy National Coordinator for Health IT, ONCHHS, Mark Goodge, the Chief Technology Officer, Military Health System, Mahesh Kalva, the Chief Technology Officer and Science and Engineering Head, Health and Life Sciences at Lockheed Martin, and Brian Phillips, the Chief Solutions Architect at NetScout Systems. We're going to talk about progress being made with Health IT. Let's start with Mark Goodge over at MHS. Mark, tell us a little bit, give us some ideas of where you see progress being made in the Health IT field.
Good afternoon. I think one of the fundamental shifts that we're seeing is better interoperability between data sets. Really allow us to shape and do more information exchanges, really nationally and internationally, on how we care, the quality of care, the type of care, and the cost of care. So give us a 360 view about how we're really focusing on the patient, the condition, the provider, bringing people more together on the healthcare condition.
Yeah, that's exciting stuff too, because I know I happen to be someone who's in the process of moving from one location to another, getting new doctors, and boy, if I don't have to fill those forms out every time I go, it'd be nice if you can just electronically transmit everything over and so forth. That'd make a big difference in the ease with which we are able to transition records. Dr. White over at HHS, tell us where you see progress being made in Health IT programs.
Thanks, Jim. The past 7 years have really seen a sea change in the use of Health IT across the healthcare delivery system. We've gone from less than a third of doctors and hospitals having health information systems that they use to take care of people to over 70% of doctors and well over 95% of hospitals having these systems in place thanks to the Meaningful Use Incentive Program. That's been a huge change across healthcare. And right now, there's really active and strong efforts to advance interoperability of health information that I'm sure we'll get a chance to talk about.
Right, yeah, Mark brought that up too. And I know it's rare anymore to go to a doctor where they don't have a laptop there. Either they're using it or an assistant's using it and they're recording things. So that's a major change where we were in the past. Dr. Alan Constantian, where do you see progress being made? Where are some of the areas where you're seeing marked progress in use of health IT to support healthcare?
Well, we're seeing progress in a lot of areas, Jim. The Department of Veterans Affairs is working a lot on access. We have pharmacy initiatives, schedule system improvements, mobile applications that allow patients to make their own appointments. And, of course, we're working especially with DOD, but also with the private sector and ONC to do interoperability. But the thing that really I want to point out is an exciting thing that we have is our patient portal, My Healthy Vet. It's not new. It's 13 years old. 10 years ago, VA pioneered the blue button where patients can be empowered. And that's the part of the equation that's sometimes missed in terms of improving healthcare. The patient plays such an important role in understanding what the doctor has said and following the orders. So since 2013, the patient can see what the provider said in the hospital in that encounter, and so sometimes that's a scary experience. Yeah. But they can see that, they can review their labs, their X-rays, what the doctor said, and we're moving to a place where the physician, that the patient can have communications, secure communications with their clinician. 1.7 million encounters of that, 1.5 million blue button downloads. And sharing the data with other healthcare systems using ONC's direct application is something that is sort of in the pipeline for us. So great application, used a lot, and moving forward and breaking new ground as we go forward.
Yeah, well said. You know, there are so many great things going on at the VA. You know, unfortunately, the press tends to focus on the negative, but there are, in many cases, the VA's well ahead in terms of its use of technology for healthcare, and I love the portal even in my own life. The ability to communicate with your physician and interoperate with a portal and things like that, as opposed to being on hold or being transferred around and so forth. So great stuff there. Good story. Mahesh, Kalva, Lockheed Martin, how's Lockheed play in this health IT world, and what are some of the areas where you see progress being made in supporting the customer base that you guys are supporting here?
Thank you, Jim. The areas that Lockheed is tremendously focusing on is the research aspect of it, especially bringing in the genomics data. The genomics aspect of it is providing the personalized medicine aspect of it to the government agencies. One great example is the Million Veterans Program, where we are collecting a lot of data. Obviously, each genome almost collects about 700 gigabytes of data. How do you calculate, how do you manage that data? How do you interoperate that data? Operationalizing that data for the research scientists who want to take the data and improve the healthcare. That is the area that is we have been focusing a lot. We have recently signed a CRADA agreement with Veterans Affairs and providing that kind of solutions. And at the same time, while this is going on from an IT perspective, traditional IT perspective, we're also leveraging mobile solutions for it. For example, at Centers for Disease Control, we launched the ability to lifeguard a tool which is on the mobile devices for all the CDC employees that are all over the world handling crisis like the Zika virus or the Ebola virus. Right. So there was a point before this solution was implemented, people were looking for, comparing the itineraries where the CDC employees were there. Now with the lifeguard solution, which runs on a mobile application right there, we can, at any given time, CDC officials can know where their employees are stationed.
Yeah, that's exciting stuff, boy, I'll tell you. And that whole research around the Human Genome Project and things like that is going to hopefully have tremendous benefits down the road in curing things that have been difficult to cure in the past. Brian Phillips at NetScout, tell us a little bit about how NetScout plays in this and how you're supporting your customers, and where do you see some progress being made in these IT programs to support healthcare?
Well, it was very interesting to hear everybody else say what their initiatives are, because they kind of dovetail to what I'm seeing from the vendor side, really with all the organizations. And we do quite a bit of work with healthcare, both in the government and in the private sector. So things that we see are all about availability, which is going to affect the patient's experience with the programs that you're talking about, as well as we're seeing a great deal of interest in the leverage of Internet of Things to be able to allow people to receive treatment and be able to monitor their treatment effectiveness from home. And frankly, the ability to be able to leverage communications mobility even better while still maintaining privacy without interrupting those signals, right? I mean, if there's an interruption in any of these delivery systems, it's going to affect not only the patient's care, but their experience with that care.
Yeah, excellent. You just hit on about 10 topics of that we use on our radio show: mobility and Internet of Things, and we do separate shows on all those. So we're doing sort of a multi-dimensional show here today. Let's talk a little bit about specifics, specific program. Our listeners always like to hear about general progress, but is there a specific program you could point to that you really think's making a difference? That's going to make a difference in the future. Let's start with Dr. Alan Constantian this time. Can you, if I asked you to pick a specific program that you think is like really going to have an impact and do something really special, what comes to mind?
Well, Jim, I love the Joint Legacy Viewer. It's something that we have in common with DoD. Mm-hmm. Back in October of 2013, we had about 500 users. Right. We have, we have right now, so as of last month, we had 41,000 logins just on the VA side and 141,000 records looked at. And the reason Joint Legacy Viewer is important is for that continuity of care, especially in the scene where veterans come across from their active service to the VA. And we don't have a lot of data on the VA side, but there's a lot of data on the military side, or in cases where veterans are being seen at different places. So we have had for almost 2 decades information on from the military health system or from the 130 different VA VISTA instances that was available. But it was almost like, say, Mark's information was in a bunch of different drawers. You know, Mark Goodge at St. Louis VA Medical Center, Mark Goodge in the military health system, Mark Goodge at the Miami health system. Now, all of that information, veteran-centric information, is on Mark Goodge, is in a single drawer, all of the labs, regardless of venue. And the proof is in the pudding, with going from 500 users about 2 years ago to 20,000 regular users monthly, but really over 125,000 people on the VA side alone being able to access this system and see this information, which they can act on for better continuity of care, more efficiency, no repeated tests, because if they've seen it in someplace else, and also more efficiency, because if you can see that, access is improved because you can get through and get the gestalt picture of the patient's situation and make decisions more quickly than if you have to hunt around for information.
Right. So do I have this right? Does this mean if someone goes from the DOD and becomes a veteran that the health information is able to go with them?
We can see that in the Joint Legacy Viewer easily.
I mean, that's been a big issue for a long, long time, and people have been trying to solve that problem for a long, long time. So that's I'm sure that makes a huge difference in the life of a veteran, right?
We've made tremendous progress in the past couple of years, and we're expanding that now to private sector care providers with agreements, so we can see that, since a lot of care is taking place in the private sector for veterans and for military.
Excellent, excellent. Mark, I heard your name mentioned in that particular conversation. Let's go to you. What are, if I asked you about a specific program, is there something else that comes to mind that you would like to point out that you think is worth mentioning here and talking about as something you're proud to see happening? Well,
I will say, on that one from the VA and the colleagues, and really, the ONC had the strategic vision to have a e-health exchange, right? And we did too, from a cooperative agreement about, who's entrusted to our care, so we can look at better health, better care at a lower cost, right? So I will say that has been a major milestone that we're both aggressively working to make it better every single day. But millions of records pass between us, right? And so when we look at a patient movement, data movement, and it goes back to this, the semantic interoperability, as you talked about, right? Gone are kind of the days of the data silos where individual records reside, and now we're creating more, I think, dynamic cloud type of architectures, or allow me, Mark Goodge, with an ID to be able to see where I want to be seen and how I want to be seen without having to duplicate exams, procedures, or waiting line to get there. So it's the quality of care and that access to care has been a major milestone for us on kind of diffusing those walls and those activities, such as telehealth, telehome initiatives, so that we can really extend what we do best to that patient in that condition. And you'll see, I think, a massive change when we talk about that, from mobility and durable medical equipment. So going home with bandages and this and that, you'll probably go home with now IT products to plug into the wall to monitor your condition remotely, so that we, of a healthcare team, can look at that condition. Wow, cool. And so that's I think a big one for us, and we're getting into that. VA's been doing a lot of work on that as well, and we see that about, when we talk about genomics, about applying drugs and drug therapies to said conditions. So instead of being, I guess, broad spectrum, we could be more specific in our delivery of healthcare and healthcare outcomes to that patient. So it's all about the patient and the data. So putting those two together with whatever ecosystem they're involved in has really, I think, changed the paradigm of what we do when we look at national and international care.
Yeah, excellent points. And what I like about this discussion, is healthcare in the country is controversial. The Affordable Health Care Act and single payer and what you can do with this. But one thing that everyone's in agreement about is, the administrative process is using IT to better move care forward. And so everything we're talking about here is like everyone's on board with this. We're not talking about the things that are controversial out there. And to hear the progress you guys are making is exciting. I mean, obviously you're trudging ahead, moving ahead. Dr. White, John White, how about if I asked you about a specific program? Is there something that jumps out that you think is you'd like to put on the table as something that you think is going to make a difference?
Jim, do I have to pick just one?
Actually, you don't.
Okay.
You
Well, I don't want to go on forever, but there's so much exciting stuff going on. I am so proud to be able to work with these two gentlemen and their organizations. The VA is absolutely a global leader in the use of health IT to deliver high quality care and has been for a long time. Our colleagues at the DoD I'm really proud to point to their recent procurement of certified health IT that they're working on deploying now throughout the military health system. That was a big deal because that was a clear signal to the market in the private sector that certification is important. Certification being what ONC does. That's the authority that we have to certify vendors, health IT vendors, and their products to show that they have certain functionalities and that they use certain standards.
Certain criteria for standards to provide the care.
Yeah, exactly. I've been involved with the Precision Medicine Initiative, which has been just really tremendous, not just in terms of the excitement about the future of science and where that takes us, but really the cooperation that I've seen across the administration, our colleagues here and at NIH and the FDA, but also out in the private sector. Just the unbelievable excitement I've seen both from technology companies, from care delivery providers, from scientists, and honestly from participants that really want to get engaged in a research effort like that. We don't call them subjects. We call them participants because they're meant to be participants in that research initiative. I would love to talk about the technological development of application programming interfaces, APIs, which we think is a best way to give people their data and data about them. There's a gentleman I know called ePatient, Dave DeBronkart, who's been a real advocate for the past 10 years for engaged, empowered participants in their care, people who are getting their care, if you want to call them patients. But a foundational piece of that is people having access to their data. They didn't used to have access to their data in an easy way, even though they had a clear right to their data under the HIPAA law and regulations. But giving them the technological means to not just have to go to the office and pick up a copy, but boom, to have it on your phone, or boom, to have it on your laptop, or boom, to have it in the cloud where you can get at it. That's been a huge deal. I am going to pick the one thing, though.
Okay,
the one thing has been the change in the business case for healthcare. And really, that's been driven very strongly ahead by our colleagues at CMS and their value-based purchasing efforts. And here's what's key to it. So, the IT, the point is not to have a laptop in front of a clinician, right? That's not the point. The point is people live longer, suffer less, and we get better value for the dollars that we spend, right?
Correct.
So so we had this great incentive program, clearly drove the adoption of IT. Now you need to use that to deliver great care and for people to get involved with their care. So our delivery system reform efforts at HHS are changing the business case for how providers get paid for the care that they deliver. And we're going from a volume-based fee-for-service model to a good outcomes model. We're paying for good outcomes.
I like that.
Yeah,
Pay for results.
It's what I want as a patient. It's probably what you want as a patient.
Absolutely.
And that's where we're going. And the key piece of that for us is that the IT is part of that. You can't get there without it.
Right.
So that's my one thing.
I like that. We're all about the result, not about the volumes, not how many patients you can see, but how many can you make better. I want to hear from our private sector guests on this too, but first we need to take a short break. You're listening to the Federal Executive Forum on Federal News Radio, 1500 AM. Welcome back to the Federal Executive Forum on Federal News Radio, 1500 AM. I'm Jim Flyzik here with Dr. Alan Constantian from the Department of Veterans Affairs, Dr. John White from ONCHHS, Mark Goodge from Military Health System, Mahesh Kalva from Lockheed Martin, and Brian Phillips from NetScout Systems. We're talking health IT. When we went to break, we talked to our government guest here about some of the specific programs they're working that they are proud of and they see making a big difference. Let me turn to our industry guest here. Let's start with Mahesh Kalva at Lockheed. If I asked you to point to a program that you think is really making a difference, what would come to mind?
Absolutely. This is a great question. One of the things that is a buzzword, as you obviously know in the marketplace, is the big data.
Right.
So one of the things that CDC has done, Centers for Disease Control, with they piloted a data analytics program to detect the outbreaks. There was a big outbreak in America, in Indiana, actually, with HIV. Mm-hmm. So we worked with the microbial transmission network team at CDC, which is charged to combine internal epidemiological data, clinical surveillance data, and lab data, and contextualizing them. So with the publicly available data sets to understand of the spread of infectious disease, by moving the data analytics to the end users, to the policymakers, to the folks who actually can visualize the data and implement solutions for them, we were able to deploy the big data solution in front of these end users. Otherwise, they would depend on the IT folks. Right. So that enabled them to visualize the data to put the preventive measures to predict the outbreak and what have you, and that allowed the CDC to basically predict about 6 times faster than what it was done previously.
Fantastic.
So this kinds of implementations of big data, leveraging technologies is helping tremendously.
Absolutely.
And as a matter of fact, this solution was based on CADS, our Collaborative Advanced Analytical Data Sharing Platform, which basically allowed these folks to generate that kind of results really fast. Wow. And it won an AFCIA award for trailblazing technology with CADS.
Tremendous. You know, it used to be find the needle in the haystack. Now it's finding the needle in a stack of needles in terms of what you're doing with big data and how fast you can do things and identify things. It really is truly amazing. The stories we hear when we do our big data radio show, it's just remarkable what we're doing in real time these days.
Just to add to that, Jim, $3 trillion is what America spends on healthcare, which is completely unsustainable. Again, big data is being leveraged from the perspective of fraud detection, waste aspect of it. That is another area that we are focusing tremendously in our R&D projects and what have you to prevent that kind of aspect that is going on across all the industries, Social Security Administration, CMS, claims processing, Veterans Affairs, and what have you.
Yeah, excellent, excellent. Yeah, I think everyone agrees, that things like Medicare, Medicaid, they're great programs, but let's try to get the fraud and abuse out of them and make them a lot more efficient. Brian Phillips, tell us about a specific program that you would identify that you think's worth putting on the table here, or something that's pretty cool.
Being at NetScout, we're usually involved in the operational aspect of supporting everything that these gentlemen have been talking about. Mm-hmm. So when I have an opportunity to actually see a program that's put in place that I can actually tell somebody at a dinner party and explain to them and they get it, is always pretty satisfying for me. So one particular one I saw working with some customers that we have in the private sector down in Florida, I actually saw visualized in a commercial that they started running once they actually got this working. So it was all about telemedicine. Mm-hmm. Now there's some challenges and some legalities around how far can you offer telemedicine, but
state laws,
exactly. But certainly within a state, and Florida doesn't have a lot of neighbors, so it's relatively easy for them to be able to deliver this service. So the commercial was that there was a mom driving around, a couple kids in the back, dropping kids off, picking them up, and one daughter is coughing. She's constantly coughing. She's wiping her forehead, and mom reaches back, touches her forehead, and it's hot. She goes, "Honey, how long you been feeling bad?" "Ever since I got up this morning and a little bit last night before I went to bed." So she calls the doctor on her phone, explains to the doctor while she's driving, which is probably not good, explains to the doctor, what's going on, actually hands the phone to the daughter, and it's a video chat, and the doctor's asking, some questions.
Right.
Honey, please open your mouth. The light turns on the phone so she could see better into the mouth. Oh, there's a lot of this going around. Hand the phone back to your mom. I'm going to call in a prescription for you. It'll be ready for pickup in about 45 minutes. So doing the work in supporting that effort originally and then actually see it being delivered was really pretty neat. Based on the other thing is based on what we do, we see everything that's running on the networks from an aspect of what you folks are doing. We always see it in context. So relative to big data, which you were speaking about, one of the interesting things our customers have come to us is since you're seeing all this data pass anyways, you could help us reduce the amount of noise around the signal that we're looking for. And we found that was relatively easy for us to do. And I've seen some real efforts in planning, especially around the national conventions for the Democratic Convention and the Republican Convention. I've seen what customers have been able to do with the signal data we've been able to provide in preparing and planning for healthcare and hopefully no advent of some sort of activity, whether it be terrorist or whatever, that could disrupt that.
Sure, but got to be ready for it. Dr. White, you had a comment on that?
Just a quick follow-up on the telemedicine piece of it. It's tremendously exciting, and it's an example of how when you introduce these information systems and these information tools in, you can do things differently in ways that you couldn't before. I love to talk about Project Echo, which started in 2003 in New Mexico, led by Dr. Sanjeev Arora. Project Echo is conceived as a way of leveraging high-value assets like the gastroenterologist at the hepatology clinic at the University of New Mexico, whereas previously people would have to drive 600 miles from Truth or Consequences to Albuquerque. Now they could stay at their local doctor, get consultation from those specialists for somebody, in this case with hepatitis C, and they could be guided in their treatment of hepatitis C in a way that they really weren't comfortable doing before as primary care doctors. Right, I'm a family doctor. That's my background, and now this resource is available to them. Sanjeev did a study where he showed before using this, implementing Project Echo, there was a huge disparity between the cure rate for people who had hepatitis C in the rural setting versus those who came to the specialty clinic at the University of New Mexico. Wow. And then after Project Echo, the rate that disparity vanished. So it was an extension of these treatment and a leveraging of treatment. Sanjeev calls them force multipliers. And my colleagues here are actually using Project Echo now across the country, variety of conditions, and Sanjeev is going around the world. So that's a great example of how we're able to do things differently in healthcare.
That's cool.
Get better outcomes.
That is a very, very cool story. Very cool story. Mark Goodge, what are you learning along the way here? Lessons learned. What are some of the things as you work your way through these programs that are, you learn that maybe your colleagues or people listening to the radio show would like to know, help them along?
Sure. I think probably the biggest lesson learned is from a strategy and planning perspective and from the business, right? Well, know the business that you're in, first of all, so you can look to apply the right technology at the right time for the right condition, right? It's probably the biggest one. It's hard to do that without having a larger tactical or city plan, which do that. And I'll have to say HHS and ONC this gave us a foundation for that, for the federal health IT strategic plan. And we've decomposed that for ours and our requirements and what we do for better health, better care, readiness, right, and cost of that, and to the requirements or the gaps for the enhancements we could do. And for the next 10 years, we've mapped out, we think, probably 4,000 or 5,000 large IT capabilities that could look at helping with the healthcare mission.
Okay.
And so we've got a 10-year city plan now with a predictive model. So as the business changes or as technology changes, we can start looking and doing more data forecasting, predictable analytics with data-driven while still keeping the requirements to the business and how that business condition might change. So we're doing really a lot more predictive modeling.
Know the business, predict the future, and stick with the plan.
As
sounds
much
like it works to me. Dr. Alan Constantian, what are you learning along the way? What are some of the lessons learned as you work your way through all these programs?
Well, I mean, I think I'd like to highlight three, Jim.
Okay.
But in brief, it's The first one is using design thinking in terms of figuring out what are the outcomes that we're trying to achieve and building that in first. Our Secretary, Bob McDonald's, really big on design thinking and has infused that concept into our organization.
I like that.
And I think that the examples I gave earlier with My Healthy Vet, the patient portal, and the Joint Legacy Viewer, their sort of organic growth and catching on shows that if you build health IT products that actually solve issues, for My Healthy Vet, it's for patients, but for Joint Legacy Viewer, it's for clinicians, those are going to be the successful products. Second thing, I think, in terms of lessons learned is it's important to build in key performance indicators early, right at the outset. So both the supported organization, the healthcare organization, and the IT organization know exactly what the expected outcome is supposed to be for that system. I remember I was back in 2006 and early 2007. I was at Centers for Medicare and Medicaid Services, and I was the acting regional administrator for Region 10, the Seattle region. And this was the second year of Medicare, the open enrollment season for Medicare Part D, the prescription drug program. And our caseworkers got information from their IT system that really didn't help them help our customers very well. Yeah. And so I called back to the IT organization, because I've been back and forth both on the business side and the IT side, and I said, you know, this system that we have really isn't helping us achieve the outcomes that we're wanting to do. And I remember the person from IT coming on the phone saying, well, we built it as designed. Yeah. And it's like, well, maybe, and it wasn't the IT's fault, and that wasn't maybe the business, but there was a failure of communication at the outset to figure out, well, what is the outcome that we want in the beginning? And then
may have not had the right players, and you need to visualize outcomes.
What is it at the end game? What do you want to accomplish? And getting those key performance indicators up front is important. And then I think the third thing is humility, in that over time we build processes. We had a project management accountability system in VA that made sure that we didn't go off the rails in some of our projects. But over time, that sort of grew and grew and grew, and it became so cumbersome that it was hard to get projects done. So we pruned that now this year under Ms. Laverne Council's leadership, and we have a new process where instead of having 57 artifacts to move a product through the pipeline, there's only 8. Okay. Instead of 5 formal reviews that take a lot of effort, there's only 2. And so so I think that it's important for all organizations to look, and really all of us as individuals, to look internally and say, well, does this still make sense? It worked at one time, but can we do better now?
Right. Yeah, I think in general, right across the board, everybody's talking lean processes, agile, DevOps, things like that. You know, and we don't need these big bang theories anymore. We need to, do things incrementally and get them done, knock them off quick. Dr. White, what do you think? Some lessons learned? Anything you can add to the discussion here that you think are something you've learning along the way?
The lessons learned that you've already heard are fantastic. So I'll point to them first. Implementation of these systems, development of these systems, it's not necessarily about the technology. It's about the people that use the technology. You've heard that. But the thing that you got to take away from that, there's probably 2 things. The first is that, you got to make sure that the people that are using the systems and get outputs from the systems and the tools, that they're part of that process and they're part of it from the beginning. Now, these gentlemen on either side of me do that well. It's harder sometimes for folks that don't have all the resources of a large organization to be able to address that. So if we want that kind of change across our whole healthcare system, then we need to make those resources available to folks. We had an extension program at ONC as part of our high-tech programs that did a great job working with small practices to help them implement. The second is just be ready to change and shift as you go along. Yeah. You get to put a plan in place, and it changes, and that's okay. And just be ready for it, and just be ready to think about kind of what's coming at you and the feedback that you're getting and what that means, and how eventually it gets you to your end.
Stay flexible and be ready to go whichever way you need to go. Brian, what do you think? What are some lessons you learned along the way over there at NetScout?
So supporting efforts like the doctors have talked about here, some of the things we've learned, maybe the hardware, school of hard knocks, right? I mean, a lot of this is new ground for all of us. It is certainly be careful not to move existing problems into whatever new framework that you're going to move in. So often I see organizations want to take on the thing that's causing the biggest problem or the biggest issue. And sometimes you have to, right? So things get out into the media, they're blown up, right? Always looking for the next story, no offense. But in support of those particular types of efforts is being able to understand and address what those issues and problems are before you move it into whatever this new framework is. Certainly, that's number one. Another thing is empowering everybody within the organization to be participating in service availability. So whether they work in radiology, whether they work in big data, in whatever group that they're working in, to be able to empower them to use those selected measuring points. I think Dr. Allen mentioned it, selecting some of those measuring points up front. Make sure that everybody agrees to those things, that they're easy to understand, and don't have too many. It's, especially in IT, people have a tendency to take everything that's possible. There's a lot of tools supporting all these products, and these products all generate their own information as well. We want to try to, it's human nature, we want to try to encompass and pull in all that information and try to make some sense of it, whereas a lot of times the indicators can be something relatively simple.
Very good point. Very good point. Mahesh, what do you think is some of the lessons learned along the way here, things you're encountering along the way that you'd like to pass on?
Sure. At the risk of not repeating myself, but I think it's the important thing is don't implement technology for the sake of technology. Okay? Implement fast, fail fast, or succeed fast. You know, iterative deployment of the solutions. As you mentioned earlier, don't wait for the big bang implementations. The second most important thing, lesson learned from our aspect of implementing several solutions across several agencies here, is the importance of data classification. So understand your data, classify them high, moderate, low. Based on that data classification, implement the solutions that are in place. Perhaps data encryption, data desensitization, data masking. All these technologies are available for us, and ensuring that at upfront aspect of it versus later on realizing, oh, what do we do with this HIPAA data or PII data or PHI data is a hard lesson. So ensuring to identify the importance of data and the data classification is a key lesson learned from some of the implementations that we have done.
That's an excellent point. That comes up in many of our shows, the importance of, when we talk security and privacy and things like that, the importance of getting that understanding up front and dealing with it before you actually get into a build phase or whatever becomes so critical. We want to talk about challenges too, but I think it's a good point here to take another short break. You're listening to the Federal Executive Forum on Federal News Radio 1500 AM. Welcome back to the Federal Executive Forum on Federal News Radio 1500 AM. I'm Jim Flyzik here with Dr. Alan Constantian from the Department of Veterans Affairs, Dr. John White from ONC HHS, Mark Goodge from Military Health System, Mahesh Kalva from Lockheed Martin, and Brian Phillips from NetScout Systems. We're talking health IT. We've been talking about progress and programs and lessons learned. Let's talk about the hard stuff, the challenges, the things that you really got to get over, the hurdles you got to jump through to get to where you really want to go. Let's start with Dr. White this time. Dr. White, what are some of the challenges you face, the hurdles you need to get over to get to where you want to go with these programs?
My favorite challenge is getting it right. So this is complex stuff. I thought things were complex when I used to deliver babies and take care of people in the ICU. Oh my gosh, it's a big health system.
Right.
And when you're trying to work with change like this, there's a lot of different dependencies. So what's really important is to do that well is you got to stay humble. You got to listen a lot. You got to talk to a lot of folks. You got to understand where they are and where they're coming from. You got to understand the we're coordinators. So when we work with our colleagues, both in the public sector and the private sector, it's really critical for us to understand where they're coming from, what they need, what they're trying to do, and how we help them to get there. And if we get that right, then we get the policy right.
Excellent. You got to listen. If you want to really do what the people want, maybe you ought to ask them what they want, that kind of thing. Mark Goodge, what do you think? What are some of the challenges, the things that you feel like the hurdle you got to get over to get to where you want to go with these programs?
I think I'll do that. The first thing from Dr. White, too, it's about the team culture, right? Building the team culture, understanding your roles and responsibilities on that crew that you're on. I think the other one is getting standards on standardization, right? So you can develop the lexicons so you have semantic exchanges of information so that people understand when we're doing this, what are the second and third order effects? It's hard to predict, but it's a necessary part of the job. I mean, like we said, where do I want to be and what are the second, third order effects of this? So we can bring more data to look at that ecosystem we all live in. To say how I would help with my partners like the DoD and VA and how we're exchanging and how we're coordinating with policies and regulations so we can really extend, I guess, what we're doing we're all in a war on healthcare, right? On the condition of disease and prevention and prevalence. So I think we can all say that, but people say that, well, you're in uniform, but healthcare is an international, national problem, right? And so together, how we do that and look at those second-order effects of how we extend from the United States into developing countries for healthcare and better health. Those lesson learns being very, I think, transparent about what we've learned from the government and from our agencies to provide that to the population for transparency of that. So there are some key challenges is really, I think, exchanging lessons learned so we don't repeat mistakes. We face the challenge together.
Just the harmonization of the data. I know back in my day of CIO at Treasury when we were working with IRS and harmonizing data between federal, state, local, whatever, so to make tax things, just what people call things is different. So just harmonizing that data was a huge challenge. Dr. Constantian, what do you think are some of the big challenges that you think need to be overcome to get to where you want to go?
Well, I loved what John said about staying humble, and I think I see that in different manifestations. That when we don't overcome our tendency to think that we know best,
that's actually I really like that. I'm going to use this one.
we sort of underperform. And that manifests itself in several ways. And, our CIO, Ms. Laverne Council, has helped us enormously in making sure that we have a mindset that stays humble. First of all, IT knows a lot, but clinicians know a lot too. And one of our watchwords in VA IT is teamwork and transparency. I guess those are two watchwords. Traits that she asks us to have. And because the dictatorship of either the clinicians or the dictatorship of the IT organization underperforms results almost all the time because both organizations have perspectives to provide. Not being humble also manifests itself sometimes in wanting to control the development process and building your own customized solutions, which are typically very expensive to build one and then to maintain because you're the only one who's maintaining that one-off system. So our strategic sourcing initiative that we've launched under Ms. Council combats against that tendency too. And then finally, Jim, as a sort of health services researcher, I was trained 15 years ago in a paradigm of having a theory, collecting the data, and then, testing a hypothesis and seeing if. But in this environment of big data, you almost have to start from the data and let the data suggest the interrelationships and leverage those to get to the outcomes that you want. And that's, I think, one of the exciting things in the future that we can use this big data and machine learning to our effect. But all three of those, the dictatorship of one organization over another, the tendency to wanting to build customized products, and to wanting the human being to be in the center of deciding what the important information is. All three of those are the same tendency of a little bit of hubris in thinking that we know best, and we don't always know best.
Understood. It never works where somebody's going to try, okay, let's all get together and do something. Here's what we're going to do. Doesn't work. Mahesh, what do you think are some of the challenges that you bump into that you need to overcome?
I think from the government perspective, the challenge that we always see is with all the electronic health records. Department of Defense has, Veterans has a separate electronic health records, and all the private care providers have a different electronic health records, if you will. So the interoperability is a huge challenge that we need to overcome. Standards, and absolutely the third one is the key, is the collaboration. Not only collaboration within the government agencies, within the private organizations as well. There should be tremendous amount of collaboration that needs to be done. As a matter of fact, as part of that initiative, Lockheed Martin created the Healthcare Technology Alliance. We bring in the behemoths like Intel's healthcare life sciences practice, Cloudera, Cisco, and Illumina, which is the genomics partner, and academia together. And we are providing solutions that matter from the perspective of providing an aligned, standard approach to address the challenges of interoperability, collaboration, and standards.
So we'll pull in, for the skill sets we don't have, we'll pull in those that have the skill sets and build the right team.
Exactly.
Brian, I want to hear from you too, but I'm going to change the question. We've got about 12 minutes left to go here, and we always like to talk about the vision for the future, where this is all going. So I'm going to start with you, Brian, and let's talk a little bit about looking into the future. What do you see as a vision for using health IT to improve health services? What's it look like down the road to you?
Well, I think from the patient aspect, things look pretty good. You look at what technology is available, you look at the programs that are being driven, I think the expectations should be relatively high from the patient point of view, that I should be able to have access to my information, whether I live in a rural area, whether I live in a metro area, and it shouldn't make any difference. I should be able to be a participant in my own healthcare. I should be able to leverage technology for things like Internet of Things, all the monitors I've seen that are being used by a variety of different vendors to be able to monitor the reactions of treatments at home. Are nothing more than amazing to me. Growing up in rural Pennsylvania, several decades ago, as my gray hair would attest, it's just amazing to me. So I think from that end, that's a big expectation for the future. From the other thing I expect to see is the amount of information that can be floated up that we are missing using big data and analytics. The amount of valuable information that's in the signal, I think can help guide us more than instinct. Things that are seen that are out of the norm. I mentioned earlier about the national conventions, and things that were brought up out of the data were nothing short of amazing. Everything from we're going to be low on this particular blood type. We're going to need to address this. There's going to be so many people that are on a variety of these. If we look at the types of prescriptions that folks have.
Health intelligence.
Right, yes, exactly. We need to stock up on everything from statins to pick the drug, right? Everything from that could affect the effectiveness of the care to people. I think the opportunity is ours to take right now. If we execute on these things, if we know what we want to go after, if we allow ourselves the flexibility to be guided by the signal that comes from the data that we look at, I think we're going to be able to accomplish great things.
Okay. Fantastic. Well said. I agree. Mahesh, what do you think? What's it look like for you down the road?
So while it's clear there's a tremendous amount of work ahead of us, the things that I'm thinking of with the dominance of Internet of Things and with cloud and the big data aspect of it and the genomics, the whole concept of precision medicine is evolving to predictive medicine. What I mean by that is preventive care is calendar-based, because that it's significantly reactive. Anything revealed by blood work may be developed in your body for many months. So what the appropriate intervention will be happening if there are some signs that you know in advance. For example, imagine a patient advanced in age had an operation surgery with a pacemaker 2 years ago. And what if it had the device of Internet of Things before a heart attack happens to him based on the signs, based on the vitals that are transmitted through the devices that he's wearing. What if at around 2:30 in the morning, the ambulance shows up before the heart attack does happen?
Wow.
So that is where I see the predictive medicine come into place with the nexus of all these technologies.
And it's doable.
And it's absolutely doable.
Really
Obviously, we need to keep in check the privacy aspect of it and the security aspect of it.
Yep. Very good. Well said. Dr. Alan Constantian, where's this all going?
Well, I think this is going in a place, Jim, where we are actually moving forward with the triple aim that Don Berwick popularized when he was at the Centers for Medicare and Medicaid Services, improving care to individuals, improving population health, and improving efficiency. And we can ride the vehicle of big data and machine learning to improve all aspects of that. You know, when you think of improving population health, this Million Veterans program that we're having with genomics, decades-long history of actual sort of patient encounters and experiences and treatments, we're going to learn so much if we leverage that opportunity and be able to improve that entire veteran health population, which will benefit not only veterans, but really the entire population and inform sort of how we do medicine. Hopefully that'll improve care to individuals, because if we detect something like the BRCA1 or BRCA2 gene, we can do interventions early that will prevent the onset of breast or ovarian cancer and other things similar to that. And then in terms of the efficiency of healthcare, access for VA is always going to be a challenge, because if you provide my health economics background, I know if you provide a good quality service and the cost of that service is modest, you're always going to have a lot of demand. So VA will always have a lot of demand for its services as long as it has good quality. But access doesn't necessarily mean a face-to-face encounter with Dr. John White in his office. Access could be a phone call in 3 months, or a reading on a wearable device, to sort of check in with the care team.
Yep.
And so by doing the smart thing that is informed by big data in terms of follow-ups, we can open up the aperture in terms of access and giving access, the right access in the right sort of modality for the right patient under those circumstances, and big data can inform us on those operational
I see themes
decisions.
developing here, which hopefully I'll be able to wrap up here in a couple minutes. Dr. White, what do you see with this? Where's this all going?
It's a tremendously exciting future. When I think back to my practice 10 years ago before I became a public servant, I think about the tools at my disposal then, and I look at the tools at our disposal now, and it's been a great change. It's good, and the future is so exciting. When I think about things like predictive analytics and artificial intelligence, I'm slightly cautious. I'm always in the sense that terms like that can gain great cachet quickly, and I think that a good and practical look at buzzword compliant kind of topics is always a healthy thing to do. But I'm tremendously excited about the opportunities there. The saying that any sufficiently advanced technology is indistinguishable from magic. I don't want this to be magic. I think it's, in addition to the advances in technology, which I absolutely see the private sector and our public sector colleagues leading us to, I think it's really important to get the policies right. And these include things like transparency about who has data, what's being done with that data, how you have access to that data. Is critical not just for us as clinicians, but for the people that we serve. So I think that I'm really excited about the work that's going on now through our colleagues at the Office of Civil Rights and the guidance they've been issuing recently around HIPAA and HIPAA regulation, and I'm really excited to see that continue.
Excellent. Well said. Good stuff. Mark Goodge, where's this going? What's your crystal ball look like down the road?
Crystal ball, right? I think we're on a precipice of a major leap forward on personalized healthcare, right? I really do. So to create the autonomy in people's lives, to allow them to have that health care around them at all times. We see that now. So if I have to put Janice on, right, the kind of face of looking in the past to the future, right? I think the architecture and the standardization and from the industry, there's a lot of fluidity in standardization now, which allows that to happen. For data hubs, we talk about APIs, but they really are plug and play. And we see that with the generation now, where they're data consumers to a level that we've never seen before. They demand on-demand data all the time. So I think that'll be a natural evolution for them, that they will expect, right, personalized healthcare to be automated just so they would with any kind of other social media interaction. Absolutely. We see that. We call it that. But again, I see that as personalized healthcare is the art of how to apply IT to a condition of their lifestyles and what they want. And look at the trending. So it's an easy lift and shift. Yep. Right, so it's a kind of a beautiful motion of how to apply technology as a science to the condition of the person.
That is excellent summary. Let me try to do my best here to try to hit on some of the highlights of the show today. We talked about in the world of progress. We talked about interoperability coming a long way. We talked about the use of portals and the access to information. We talked about research coming a long way in the genome program and how things are progressing there. Some of the specific things we talked about were the Joint Legacy program, the Viewer, is making great strides between VA and DoD and how you interoperate together and move information around. The certified health IT, the fact that there's a certification process in place is going to be very important. I resonated with the precision medicine idea and the use of APIs to allow this interchange of data. And then we talked a little bit about business cases for healthcare and the importance of big data, and we talked about Project Echo in there and the difference it's making. On some of the lessons learned, we talked about knowing the business plan, design thinking, thinking of outcomes, and think about the result you're trying to achieve, not let's figure out an IT system, let's figure out a result, and then how the IT can support that result. Challenges, the ones I resonated to was listen. If you really want to get it right, let's find out what it is that we really need to have in place here. The need for team culture, standards are important, and the one that really jumped out at me is staying humble. That came up a number of times, and I think that's a very important concept that, hey, I might be a clinician or I might be a doctor here, but I need to understand what these folks want. I'm not, know-all and be-all for what we're going to do here. Interoperability, collaboration came out as two important issues. As we look to the future, I heard patient real-time access being a big item. Personalized healthcare came out, that in the future individuals are going to have much more control over their own healthcare information and what they're doing to take care of themselves. I also heard and resonated with the predictive analytics that the tools are going to be there to predict things before they happen, especially as we have new smart devices and wearable devices. And in the end, it's all about saving lives. It's all about improving life expectancy. So with that, I want to thank our panelists for being here and taking time from your very, very busy schedules and sharing your thoughts with us. I want to thank our sponsors, without which we don't have a program. Thanks for being with us. Thank the good people here at Federal News Radio, who always do a great program and put on a good, help us make this program go easy. And most importantly, thank you to our listening audience out there who tune in. You've been listening to the Federal Executive Forum on Federal News Radio 1500 AM.